Your sleeping position tonight could affect your baby's oxygen flow, and most pregnant women have no idea. Pause. As a doctor, I need every pregnant woman watching this to hear me very carefully before you go to sleep tonight. Please don't skip this video. What I'm about to explain could protect both you and your baby. Because one small habit, something you do every single night without thinking, may place dangerous pressure on your body during pregnancy. And the frightening part is, many mothers don't notice the warning signs until their body is already struggling. I've had pregnant patients walk into my office exhausted, dizzy, short of breath, believing it was just a normal part of pregnancy. But after asking one simple question, how are you sleeping at night? Everything changed. One mother told me she kept waking up suddenly in the middle of the night feeling pressure in her chest. She thought it was stress. She thought it was anxiety. She thought she was overreacting. But the real problem was the position she slept in every night. And what scared her most was discovering how long it had been affecting her circulation without her realizing it. If you're pregnant right now, this information matters tonight, especially if you're in your second or third trimester. Because as your baby grows, your body changes dramatically on the inside. Your heart works harder. Your circulation changes. And certain sleeping positions can place pressure on major blood vessels that your baby depends on. Most pregnant women are never told this clearly enough. And some only discover it after experiencing symptoms like dizziness, nausea, rapid heartbeat, or waking up unable to catch their breath. Watch carefully because the next few minutes could explain symptoms you've already been feeling. And in a moment, I'm going to explain the exact sleeping position doctors worry about most during pregnancy and why it can become dangerous if ignored. A few months ago, a pregnant mother came into my office looking completely exhausted. She told me she hadn't been sleeping well for weeks. Every night, she would wake up suddenly feeling pressure in her chest, sometimes dizzy, sometimes struggling to catch her breath. At first, she ignored it. She told herself this is probably just part of pregnancy. And sadly, that's exactly what many women think. But then she said something that immediately caught my attention. She told me the symptoms always seemed worse after sleeping in one specific position. That's when I started asking more questions. How long had this been happening? How often was she waking up? What position was she sleeping in most of the night? And what scared her most was realizing this had been happening quietly for weeks without her understanding why. She had no idea that the way she slept could affect blood circulation during pregnancy. Have you ever woken up feeling dizzy while pregnant? Have you ever felt your heart racing after lying down for too long? Many women think this is harmless, but it isn't always. Because during pregnancy, your body is carrying extra weight, extra pressure, and major changes in circulation that most people never actually see. And sometimes your sleeping position can make those changes much harder on your body. I want you to listen carefully to this part, because many pregnant women experience warning signs without realizing what their body is trying to tell them. Comment below if you've ever experienced dizziness, shortness of breath, or discomfort while trying to sleep during pregnancy. You may be surprised how many other mothers have gone through the exact same thing. And in a moment, I'm going to explain the exact sleeping position doctors worry about most, and why it can become dangerous later in pregnancy if ignored. Why sleep position matters. Now let me explain why this matters medically, because this is the part most people never hear. During pregnancy, your body is doing something extraordinary. Your heart is pumping more blood. Your oxygen demands increase. Your circulation changes to support both you and your growing baby. And as your baby grows larger, your uterus becomes significantly heavier. By the second and third trimester, that extra weight can begin pressing against important blood vessels and organs inside your body, especially when you lie in certain positions for long periods. One of the most important blood vessels involved is called the inferior vena cava. This large vein carries blood from the lower part of your body back to your heart. And when pressure is placed on it for too long, circulation can become less efficient. Imagine a garden hose being stepped on. The water still moves, but not the way it should. That's very similar to what can happen inside the body during certain sleeping positions late in pregnancy. When blood flow becomes restricted, your heart has to work even harder. And sometimes your body responds with symptoms like dizziness, nausea, sweating, shortness of breath, or sudden discomfort. Your body is working harder during pregnancy than ever before. And even healthy mothers can experience this. That's why doctors discuss sleep position so seriously during later pregnancy. Because it's not only about comfort, it's also about circulation. It's about oxygen delivery. And it's about reducing unnecessary pressure inside the body while your baby continues to grow. As the uterus expands, it can also place pressure on surrounding organs. That pressure may affect breathing comfort, digestion, back pain, and even how rested you feel when you wake up. Some women wake up exhausted after sleeping for 8 hours because their body spent the entire night under strain. And the difficult part is that many mothers never connect these symptoms to sleeping position. They simply assume pregnancy is supposed to feel this uncomfortable. But sometimes your body is actually trying to warn you. This is why understanding sleep position during pregnancy is so important. Not to create fear, but to help you recognize what your body may already be trying to tell you. And in the next section, I'm going to explain the exact sleeping position doctors become most concerned about during later pregnancy, and why so many women accidentally spend hours in that position without realizing the potential effects. The dangerous sleeping position. One of the sleeping positions doctors worry about most during later pregnancy is sleeping flat on your back for long periods of time. And this surprises many mothers, because nobody warns women enough about this. If you're in your second or third trimester, I need you to pay very close attention to what I'm about to explain. As your baby grows heavier, lying flat on your back can place significant pressure on major blood vessels deep inside your abdomen, especially the inferior vena cava, the large vein responsible for carrying blood back to your heart. When that vein becomes compressed for long periods, circulation may become less efficient. And when circulation changes, your body can begin reacting in ways many women don't immediately recognize. You may suddenly feel dizzy. You may feel pressure in your chest. You may wake up sweating, nauseated, anxious, or short of breath. Some women even describe feeling an overwhelming sense of discomfort that disappears once they change positions. And the scary part is, some women experience these warning signs without realizing what they mean. They think it's just normal pregnancy exhaustion. But sometimes the body is reacting to reduced circulation caused by prolonged pressure while lying flat. Now, I want to say something very important here. This does not mean panic if you occasionally wake up on your back. That happens to many pregnant women. Your body will often naturally shift positions during sleep. The real concern is prolonged pressure over time, especially later in pregnancy when the uterus becomes much heavier. This is about awareness, not fear. It's about understanding how your body changes during pregnancy and why certain positions may place unnecessary stress on your circulation. You may have experienced some of these symptoms already without ever connecting them to the way you sleep. And that's why this conversation matters. Because many women spend weeks, sometimes months, waking up tired, dizzy, uncomfortable, or breathless without understanding what's happening inside their body. I've had patients tell me they felt immediate relief simply by adjusting how they slept. That's how powerful positioning can become during pregnancy. And what's happening internally is actually very dramatic. Imagine the full weight of the uterus pressing downward for hours while blood vessels are trying to circulate efficiently. Your heart works harder. Blood return becomes more difficult. And your body begins compensating the best way it can. That's why some mothers suddenly feel weak or lightheaded after lying flat for too long. And in the next section, I'm going to show you exactly what happens inside the body during this process, including the symptoms many pregnant women completely ignore until they become severe. What happens inside the body? Now let's talk about what actually happens inside the body when circulation becomes restricted during pregnancy, because this is the part many people never truly visualize. When you lie in a position that places pressure on major blood vessels for too long, blood may not return to the heart as efficiently as it should. And when circulation changes, your entire body can begin reacting. Some mothers suddenly feel short of breath. Others wake up dizzy, sweaty, nauseated, or strangely anxious. Some feel their heart pounding. Others experience pressure in the chest or a feeling that something just doesn't feel right. And many women don't realize these symptoms can sometimes improve simply by changing position. When oxygen-rich blood flow becomes less efficient, your body immediately starts trying to compensate. Your heart works harder. Your breathing may change. Your muscles may feel weaker. And your body may struggle to fully relax during sleep. That's why some pregnant women wake up exhausted even after spending hours in bed. The body never truly rested. Imagine carrying extra weight inside the abdomen while major blood vessels are being compressed for hours at a time. It creates strain, and your body sends warning signals long before most people recognize what's happening. Listen carefully to what your body is telling you, because persistent dizziness, repeated shortness of breath, sudden nausea while lying down, or unexplained discomfort should never be ignored. Your body is often trying to tell you something before you even understand what's happening. I've had patients tell me, "I thought I was just tired," but after adjusting their sleep position, they noticed a major difference. They slept more comfortably. They woke up feeling better. They experienced less dizziness. And in some cases, they finally understood why they had been feeling so physically drained every morning. Has this ever happened to you? Have you ever woken up during pregnancy feeling weak, overheated, breathless, or strangely uncomfortable while lying flat? You are not alone. And this is exactly why doctors take sleep positioning seriously during later pregnancy. Because the body changes dramatically as the baby grows. The uterus becomes heavier. Pressure inside the abdomen increases. And even healthy pregnancies can become more physically demanding on circulation and breathing. Never ignore persistent discomfort, especially if your symptoms repeatedly appear while lying in certain positions. Your body is incredibly intelligent. It often warns you before a problem becomes more serious. And in the next section, I'm going to explain the warning signs many pregnant women dismiss too quickly, even though those symptoms may be their body asking for help. Warning signs most women ignore. Now here's what concerns doctors the most. Many warning signs appear gradually. So gradually, in fact, that many pregnant women brush them off completely. They assume it's normal pregnancy discomfort. But sometimes these symptoms are your body reacting to pressure, circulation changes, or physical strain during sleep. Please pay attention to these signs. One of the most common symptoms is dizziness, especially after lying flat for a long time. Some mothers suddenly feel lightheaded the moment they wake up or try to sit up. Others describe feeling weak, shaky, or faint for no obvious reason. Another major warning sign is chest pressure. That heavy feeling across the chest that makes it difficult to fully relax or breathe comfortably. Some women wake up in the middle of the night gasping for air or feeling breathless. And that experience can be terrifying. A racing heartbeat is another symptom many women ignore. You may suddenly feel your heart pounding while lying down, even when you're trying to rest. Your body may be working harder to compensate for circulation changes happening internally. Some mothers also experience numbness or tingling, especially in the legs, hips, lower back, or arms after staying in one position too long. And while occasional discomfort can happen during pregnancy, repeated symptoms should never be ignored. Listen carefully to your body, because your body sends warning signals. And the frightening part is that many women continue experiencing these symptoms night after night without realizing their sleeping position may be contributing to the problem. I've had patients tell me they thought they were simply becoming more exhausted as pregnancy progressed. But after changing how they slept, they noticed dramatic improvements in comfort, breathing, and overall rest. If this sounds familiar, speak with your doctor. You should never feel afraid to ask questions during pregnancy. Never feel embarrassed about discussing symptoms that concern you. Because sometimes the smallest details reveal the biggest answers. And many women only realize the importance of sleep positioning after weeks of discomfort they thought they just had to tolerate. Have you experienced any of these symptoms during pregnancy? Dizziness, chest pressure, shortness of breath while lying down, a racing heartbeat at night? Comment below and share your experience, because other mothers watching this may realize they're not alone. Safest sleeping position. So, what is the safest way to sleep during pregnancy? In most cases, doctors commonly recommend sleeping on your side, especially the left side during later pregnancy. And there's an important reason for that. Sleeping on the left side may help improve circulation and reduce pressure on major blood vessels. It can also help blood flow move more efficiently between your heart, your body, and your baby. And for many women, this position may reduce symptoms like dizziness, shortness of breath, and discomfort during sleep. But I also want to say something reassuring here. You do not need to be perfect. If you occasionally wake up on your back, do not panic. Most people naturally change positions during sleep without realizing it. This is about reducing prolonged pressure over time, not creating fear around every movement at night. You do not need to be perfect. just informed. And honestly, side sleeping can feel uncomfortable at first for many pregnant women, especially as the body changes and the baby grows larger. That's why small comfort adjustments can make a huge difference. Placing a pillow between your knees can reduce strain on your hips and lower back. Some women place a pillow behind their back for support so they feel more stable while sleeping on their side. Others use a pregnancy pillow to support the belly, legs, and spine all at once. And sometimes, even a small adjustment in positioning can completely change sleep quality. Your comfort matters too, because this is not only about protecting your baby, it's also about helping your body rest, recover, and function more comfortably during pregnancy. I've had patients tell me they slept better almost immediately after changing their sleep setup. They woke up breathing easier. They felt less pressure, less dizziness, less strain. And for the first time in weeks, they actually felt rested. That's how important positioning and support can become during later pregnancy. So if side sleeping feels difficult right now, don't become discouraged. Your body may simply need time, support, and gradual adjustments. Small changes can make a huge difference. And in the next section, I want to speak to you not just as a doctor, but as someone who genuinely wants pregnant mothers to feel informed, supported, and less afraid during this journey. I want to pause for a moment and speak to you not just as a doctor, but as someone who has cared for many pregnant mothers over the years. As a doctor, I never want women to hear information like this and feel frightened. I want you to feel informed. I want you to feel empowered. Because pregnancy already comes with enough anxiety, enough physical changes, and enough emotional pressure. Knowledge should help you feel safer, not helpless. And one of the hardest things many mothers go through is wondering whether what they're feeling is normal. Some women stay silent about symptoms because they're afraid of overreacting. Others convince themselves they should just tolerate discomfort. But please hear me clearly. You are not overreacting by asking questions. You deserve clear information. Your health matters. And the way you feel during pregnancy matters too. I've seen mothers apologize for bringing up dizziness, for mentioning chest pressure, for saying they felt uncomfortable lying down, as if their symptoms were unimportant. But they are important. Because sometimes small symptoms reveal important changes happening inside the body. And every mother deserves support during this journey. You should never feel embarrassed about speaking with your doctor if something feels unusual. Never feel guilty for wanting reassurance. That is part of protecting both yourself and your baby. And honestly, many women feel relieved once they finally understand what their body has been trying to tell them. Sometimes a simple change in sleep position, support, or routine can make an enormous difference in comfort and rest. So please don't watch this video with fear. Watch it with awareness, with confidence, and with the understanding that your body deserves care, attention, and support during every stage of pregnancy. Mistakes pregnant women make. One of the biggest mistakes I see during pregnancy is mothers assuming every symptom is just pregnancy. And while many discomforts can absolutely be normal, some symptoms deserve closer attention, especially when they keep happening over and over again. Many women ignore repeated dizziness. They ignore chest pressure. They ignore waking up breathless or uncomfortable every night. And sometimes they continue sleeping in positions that make those symptoms worse simply because it feels familiar or temporarily comfortable. One common mistake is sleeping flat on the back for long periods because it initially feels easier on the hips or shoulders. But as pregnancy progresses, that position may place increasing pressure on circulation and breathing. Another mistake is avoiding conversations with doctors because mothers worry they're asking too many questions. I want you to remember this clearly. If something feels wrong, speak up. You are never wasting your doctor's time by discussing symptoms that concern you. In fact, those conversations are often extremely important. I've also seen women convince themselves that exhaustion, dizziness, or discomfort are things they simply have to tolerate. But your body is incredibly intelligent. It constantly sends signals. And repeated symptoms are not something you should automatically dismiss. Never ignore repeated discomfort. Trust your instincts. If your body repeatedly reacts the same way in certain sleeping positions, pay attention to that pattern. Because many mothers only realize later that their body had been warning them for weeks. And sometimes the smallest adjustments, Changing sleep position, adding support pillows, or discussing symptoms early can dramatically improve comfort, rest, and overall well-being during pregnancy. So please do not silence your concerns. Pregnancy is not a time to ignore what your body is trying to tell you. It's a time to listen more carefully than ever before. Before we finish, I want you to carry this with you tonight. Before you go to sleep, remember this. Your sleeping position may affect more than just your comfort. It can influence how your body rests, how your circulation works, and how supported you feel throughout the night. I'm not saying this to create fear. I'm saying this so you can make informed, calm decisions about your body. A simple adjustment in how you sleep, adding support, changing position, or avoiding prolonged pressure on your back could help your circulation, your rest, and your overall pregnancy experience. And sometimes it's these small changes that make the biggest difference in how you feel every morning. If this helped you, share it with an expecting mother who needs to hear it. And tell me in the comments, did you know sleep position could have this much impact during pregnancy? If you found this video helpful, please share it with your friends and family and leave a comment to tell me what you learned. Your support goes a long way in spreading the message and growing this community. Thank you and see you soon.